Hi.
Are we live?
I don't know.
Are we probably bad? Meaning connection. All right.
Oh no, you know what I did? I didn't
What?
put on a mic. Let's see. Ah. Okay. I've been crackling.
So sorry for the delay. I actually am.
Delay schmalay.
Yeah, I'm
People come in and whatever.
Yeah, I am actually trying to do this because I like being in the live, but I have school
Yeah.
at 9:15,
So you can't stay the whole time. Let's see if we're up and running though. And if we can be heard.
can.
Oh look, someone has their volume on. How nice. There we go. So we're live. It seems like we're live on Facebook. Hi everybody.
Are we very choppy?
Please let us know if you can hear us and see us well enough. You know, as always, we're trying new things. I wonder actually if that's bright enough. What do you think?
Right enough? Nah, I'm not sure.
You think you can do hickey that till like 60 or something?
Sure.
I think that's a good idea. Perfect. Ta-da! I guess
Ta-da!
keep moving this thing. Your dad won't be able to sit. Hi everyone! So we're starting soon. I guess just waiting for a few people to come in, making sure we can be heard and seen and stuff.
And so we can start talking about today's topic, which is...
What is today's topic, Gavin?
I have no idea. That's why I'm asking you.
Guess. Okay, we gotta know, we're a little high on headroom, but that's because we're gonna have a special guest today. Actually, two. We're gonna have, who are we gonna have as a special guest?
Me. That's for
Besides you.
my dad
Yeah.
and VVR.
Yes.
Lola.
So his grandmother and his papa and my husband, our CEO at VMV, is gonna come and join us because our topic today is...
No idea!
You don't? Did I tell you? Hair loss and men's skin
Ah,
care.
yes,
Ah,
right.
yes.
I thought that was
I
next
totally
week.
told him. He totally forgot.
Yes, I did.
Ah.
Wait, I got the mic right here. Can we attach it? The mic?
Nah, we're good. I think we can be heard, and this might actually have less crackling. Can you put that back then, please?
Okay.
Because it shouldn't be out and played with, because I think that's an issue.
Ow.
Okay.
I just looked right in the light.
So for those who said we're high in headroom, yes, that's on purpose, because we do have a guest coming later, assuming we can stop moving stuff that's been set up well. Could you get up, please?
Why?
Because we moved it back again.
I'm so sorry.
Okay, everybody stop. 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 Stop.
No.
Come here. Okay,
Oh.
we're gonna start.
Fall.
Yeah, but I want to start and say hi to everybody already. Right? Where are you going? Gavin, just there.
It's wobbling.
But it was fine.
There. It's just...
Could you come sit without moving there so that we can...
Sure.
Okay.
All right. All right.
Okay, so you're a little low, but that's okay because we're going to have a special guest later to join us for our topic. Ay,
Yeah.
lumabiste. Ahora se ve todo. Mira.
What?
Now you can see all of it.
Yeah. So sorry.
It'll have to do. Wampy, while we're waiting, can you help? Because Gavin moved this thing, so now...
Yeah, I'm a bit clumsy today, unfortunately.
See, so we can...
Our own production
ves o no?
crew.
¿Lo ves?
Yes.
No, ya está, me parece, ¿no? That's him. He's going to be joining us in a bit, so...
Yeah, he's our production crew and sometimes guest.
Oh, a
Very
production
sometimes.
crew.
Yeah.
But
10 more minutes. Well,
that's
actually,
good. Okay, you
kinda.
know what? Let's get started.
This is our Skinsights live stream on hair loss and men's skincare.
Welcome to Skinsights Live. on hair loss and men's skincare.
That's what I said.
Yes. So you want to do that whole thing? Because I know you like doing that. Before we get started,
If you're watching on YouTube, please like, subscribe, and click the notification bell so you don't miss out on another video. And also, please comment a question, DM or PM.
yes.
And if you're on Instagram,
No, not direct message or private message. Just comment on the stream.
Yeah,
And comment early with your questions so I can make sure
that we
that
answer them.
we get them answered.
Don't forget to don't forget to comment on other topics you'd like to learn about too.
Exactly. So today, if I'm not mistaken, we're giving away a pre-shave barber oil and a shaving cream 3 as well, which is awesome. So to qualify for that, please remember to like,
Subscribe.
if you're on Facebook, if you're on YouTube,
No.
subscribe. No.
No. If you're on YouTube and Facebook, please like. If you're on YouTube, please like, subscribe, and click the notification bell so that you don't miss out.
Yes,
on
but
another
also
video.
to qualify, you also have to comment with a question. So
Yes,
at the
you
end of the live, we're going to be randomly picking winners, and you'll get both the shave cream and the pre-shave barber oil.
Can I
I'm not
be
even
a
sure if I
winner?
have a pre-shave barber oil. I should in there. Okay, so to get us started, hair loss obviously isn't something that just affects men, right? Alopecia can also happen with women, but
It's more common in women.
and it's Lola will get your Lola is Filipino for grandmother. His grandmother Lola will get into that in more detail later. There are different types of baldness, although some can be shared, right? But arguably baldness is the classic fear of a lot of men, right? I think less so now as we've become more comfortable with sort of shaved heads and different options for men.
Yeah.
But yeah, so it's kind of, I know I've gotten a lot of questions about hair loss from male friends, and a lot of them have to do with newer treatments for hair loss, especially because a lot of them are actually really good, but come with some side effects, like loss of libido. Do you know what libido is?
No.
That's sexual desire.
Okay.
It's not a big deal, but some men don't want to lose that, right? Because sex is a healthy part of humanity, correct?
Yes.
He's actually learning about puberty in school, so it's kind of perfect. So please comment early with your questions so that we can make sure to get them answered by my mom, our founding dermatopathologist, who's going to be talking to us about all of this.
Okay, wait, hold on. What's the difference between a dermatologist and a dermatopathologist?
A dermatopathologist first has to be a dermatologist, but then also develops further into the specialty of skin cells. So when you take scrapings or a biopsy, the person who reads the cells under a microscope, that is a dermatopathologist. Yes.
Yes.
Okay, I want to clarify something. Today, we'll be talking about skin care for, it's not so much gender and what you identify with, but sort of what, in skin in particular, it's what your hormones dictate.
Yes.
Under a microscope,
We're
skin
learning
is
about-
actually skin.
Yeah, we're learning about hormones.
There you go. But under a microscope, if you just look at skin cells, across men and women, they're actually
The same.
the same. Skin cells are skin cells. Skin cells mostly differ in terms of how they might behave, like produce more or less melanin, depending on your race or ethnicity. Melanin is the pigment of our skin.
Oh, I thought you meant like
That's
melatonin.
it. But if you, for example, have acne, then an acne treatment for women should work for men if it's that particular type of acne. So for VMV, to be clear, there are, among different genders and races and countries and markets, different skin conditions can be more or less common, different preferences certainly, but under a microscope, skin cells are skin cells, which is why, for example, you don't tend to see a laser for women and a laser for men.
Yeah.
You don't tend to see
It's just
clobetasol steroid for women or for men. You don't tend to see an injectable or an antibiotic for women or for men. Actually, hormones you do see for women or for men, and we'll get into that later.
Yeah.
Right?
Yeah.
But so at VMV, this is why, for example, all of our products are not
Men and women.
targeted, yeah, for men or for women. They're for all skins on all people. And the important thing is to look at what your particular concern is. That's what you look for. So you don't look for, I don't know, you don't look for what's for female, I don't know. You look for, I have rosacea, I have eczema, I have seborrheic dermatitis, I have dry skin, I have oily skin, I have acne, hyperpigmentation. That's what you look for, and that's how you choose skincare.
I forgot my question.
Oh, I'm sorry about that. So there. So if your concern is acne, use our Super Skin line or ID line. If it's hyperpigmentation, look for Illuminance. And if it's rejuvenation, look for Everything.
Yeah.
But sort of some of the more popular products that we make. Yes, darling.
If I'm right, it's marketed for men and for women, because for women, like stuff, it's pink tax.
Thank you for bringing that up. There's something that's known, thank you, as a pink tax. My son is a feminist.
Yes, I am.
We're all feminists. So anyway,
Yeah.
a pink tax is when companies charge extra for products sold to women. And they could be the exact same thing, but because they're packaged in pink things, it's called a pink tax. It's actually outlawed just recently in New York State, so yay. But we've never done that. Everything we make just assumes skin. What does your skin need, right?
So for example, I'm just gonna hold up, like,
let's do the examples with this stuff, right? So I can talk about what's popular among a lot of our male clientele. So especially, we're talking about hair loss, right? Some of what can cause hair loss is stress on the hair shaft,
right,
or the follicles. There's like something in my face. Sorry. So Superwash is a great option, and so is Clark Wash. Seriously, Gavin, what's on my face? There's something that's really bothering me. You see, it's like a hair. So
sorry.
Superwash and conditioner
Again,
are great
Superwash.
options. Here's the conditioner.
and
Right. Because they are gentle on the hair shaft and hair follicle. Plus, they're gentle enough for frequent use. So that's good. And then, in terms of cleanser, you're really spoiled with a choice. I myself use the pre-shave scrub. That's actually my stock. So
I
it's
have
a
to
little
go.
wet.
I have to
Oh,
go.
what's happening? Okay.
So sorry.
Bye. Love you.
Love you.
So I
Bye.
use our pre-shave scrub, but honestly, again, you can use any cleanser depending on what your skin type is. For example, from our Super Skincare line, there's no way you can see this. We had to back everything up because we have guests today. There we
Let
go.
someone else.
There we
let
go.
Someone else do it.
Okay. So, point being, use any of our stuff. I mentioned earlier, if you are concerned with rosacea, look for Red Better. If we're concerned with rejuvenation, get the Everything, or hyperpigmentation, it would be Illuminance. Okay, if it's for shaving, what a day, folks. Okay, so for shaving, we do have the 1635 line. It can be used by men or women, and there are several options. I guess I'll go through later. But I will go through very quickly what we're offering online. By the way, you can get all of these products at vmvhypoallergenics.com internationally and vmvhypoallergenics.ph in the Philippines. And in the Philippines, we have a special now, which is pretty cool. Again, it's not sort of gendered marketing. There's no way you can see this. Anyway, it's a cute pouch. It says I get my due. And it comes with a mini oils well, which is our virgin coconut oil with monolaurin. And it comes with our Clark Wash Mini, one of the hair things I was talking about earlier, the hair and body washes, a Red Better cleanser, and what is this? And a conditioner. So yay, so you kind of get the whole thing. So you get 4 of these things in this pouch when you shop in the Philippines. In the United States, we have a special on our Know-It oils, which is our clinically published organic virgin coconut oil, which is this guy. And this is sort of an excerpt of one of the abstracts of one of the clinical studies. That's ongoing online in the United States. Also in the Philippines, in the clinic, we do sell the monolaurin pellets, which are great for anti-inflammatory everything. And yeah, let us know if you have if you're interested in a teleconsultation with my mother or other doctors and nutritionists that we work with, and we're still looking for subjects for hidradenitis suppurativa. So yeah, so drop us a DM or PM if you have that condition or you know anyone who does. And as a reminder, if you've had a patch test, you can let us know your results and we can help customize recommendations for you based on your patch test results. And without further ado, I will introduce two special guests today, not just one. First is our resource expert, who you already know, Dr. Roman Viralio Raul, as well as my husband, Juan Pablo, who is the COO of VMP Hypoallergenics. So we're very high science, but still very much a family company. Hi, Mom. Hi, Juanpi.
Hello, hello.
Can you fit?
Yes, I can fit.
Okay.
There.
So here we are. So there. She is, Dr. Viralio Raul is a dermatopathologist, and perhaps because she's a specialist who reads cells under a microscope, she's always been really, really targeted about the cause. Is that your phone?
Yes.
Okay, the cause, not necessarily, I don't know, the gender of a person, right? I mean, she'll definitely ask about hobbies, lifestyle, etc. I need to
Sleep
that.
then.
Yes, sleep, diet, nutrition, etc. Yeah, you want to sit on this one? I know you like
yes.
sitting on something.
Yeah,
Ta-da!
there.
Okay.
That feels so much more comfortable. And I don't feel so short.
So there, but so say hi to everyone.
Hello, everybody.
You can also say
Hello, everybody.
hi. Okay, so let's start with, is there a difference between male and female skin in terms of sex, not gender, right?
Yeah, there are quite a bit of difference, but bottom line in these differences is really you look at the different environmental, personal things that contribute to that difference. Like for instance, a woman who runs a lot and is out in the sun will have a different kind of skin tone, dryness, wrinkling, development of tiny warts and all of that. And will, look like if she were to be examined under the microscope or done with, we do all sorts of testing for thickness, pH, redness, scaling and all that of the skin. It would look almost like a man's, and then I just reviewed some studies that came out which showed the differences between male and female skin. And again, I thought, basically the differences are really due to something else, due to the environment, due to this, due to that.
What do you call them? Exposomes.
Exposomes, right. So I really rather look at the problem. What's the problem of that particular skin? It is, she's young, she's only 30, but she's so wrinkled already, So
Or
why?
he, 'cause
What
this is
brought
men's
she or
skin,
she or
right?
he?
So
Right. He's a cook.
I think
There,
also
infrared light can do it.
yeah,
Yeah.
right. And I
Things like
think
that.
also part of the maybe struggle is that some men, I think this is less of a case now, thankfully, but I think some men are taught early on that skincare is for girls, right?
Right.
Which it really isn't. I know that was the case pretty much.
Yeah, it was unheard of when I was growing up to use anything.
Right. So when we were dating, his version of washing his face was like shampooing and just letting it wash down his face.
Sometimes.
Sometimes. So that's thankfully
For
changed.
you guys out there who are still shy about going to a dermatologist, by the way, skin care expert as well, not just for skin diseases, just know that years ago, remember I've been in practice for 50 plus years, and years ago I used to see more women asking about things for their maintenance and all of that. But now I'd say the men that come to my clinic seem to be as much as 40%. There are just as many men who come asking about this, that, and the other thing. So don't be shy.
Right. But so again, just a quick summary as of where we are right now. Under a microscope, skin cells are skin cells. There isn't really a difference between men and women's skin. So if you're concerned about acne or rejuvenation or whatever, you don't look for the men's stuff for
I
that.
see what
right?
you're going.
You
Yes.
look for the treatment that is for that concern,
Yeah.
right? There are some things, however, that do affect men that don't affect women, right? What are some of those things?
They can have a form of hair loss. Leading on to the next
Yes,
topic you're going to ask
exactly.
me, the forms of hair loss in men differs from the way it looks in women.
Okay.
But both are driven, though, by the same kind of hormones. And, so that's one difference, for instance. And of course, you can have in women some changes that are basically due to the estrogens that they carry, that they have much more of than the men. Men have much more of the androgens on the other side. So anything that's androgen related will probably appear more or bother them more.
Doctora, is that a matter of degree or of a difference? Like, is it appears more in one and less in the other, just so it's a degree issue, or is it a very different thing?
Again, similar, thank you for the question, Nombi. Again, similar to the men and women analogy I was trying to make, it's a matter of degree because there are just less androgens in women. Men and women both have androgens as well. But in men, it's much more because he's a man, he develops all his organs and all of that and maintains it.
He
Whereas-
develops all his organs.
systems.
Or not. There's some conditions where they don't. We were just learning about this
That's
last
right,
night.
but we're not going
We're
there
not going to
at all.
go there.
And women basically have the estrogens that allows them to have menstruations, that then allows them to have an ovum and etc. and have a baby. So obviously, yes, there are differences.
Right. So if there, obviously there are certain conditions that will affect
But in
only
degree, yes.
only the genitalia, or for women that will only affect you in pregnancy. Otherwise, you look for, if I have a skin concern, if I eczema, psoriasis, whatever, I look at the skin concern. I don't look at stuff for men.
Yes.
Right. That's kind of key.
No, when a male comes to my clinic and says, "What can I do for skincare? What can I do to make my skin look better?" So I will look at his skin, right, and look at what kind of, say, photoaging he is developing. Is it just the earliest stage where there's hardly any wrinkles yet, where there's maybe a little bit of wrinkles in the smile, the laugh lines. But otherwise, his skin looks pretty good, except for he may have scars from acne. So it's an analysis of what he has, and then going into the causes for each of those things that you see in the skin, and then, focusing on them and taking care that they no longer happen. Let's say, of course, the best example would be the use of a visible light sunscreen, because it's the thing that we are most exposed to, the monitors of our computer, iPads and telephones. So visible light, that is, blue light is notorious for producing visible light problems of pigmentation, also wrinkling, because it really can penetrate deep into the
Right.
skin and affect the collagen, etc.
Okay.
Anyway,
So going quickly, because we have some questions, and again, I want to make sure we get them in. Matanglawin 03 on YouTube, is hair loss specifically for men or also for women? If it's in terms of what we're going to be discussing today,
Yes.
we're going to focus on hair loss for men. But in order to discuss that, there's going to be some comparison.
Yes.
So I think that's maybe a good time to talk about,
we can start.
yeah, what is the difference between hair loss for men and hair loss for women?
The hair is the pattern. And exactly why the pattern is different for a man and a women, nobody seems to really quite know yet. But the research is there. The molecules, the genes are being studied right and left nowadays. So that will come. But the pattern in women, in men first, is that they first have a recession here, and then it becomes M-shaped. And then at the same time, the vertex, the top of the scalp, also becomes thinner there a little bit. But it's got lots of hair.
He's still furry, but it's slowly
Yeah,
here.
the rest of the body, by the way, hair will continue to be the same. This is different. Only the androgen hairs are affected. But in particular, in the scalp, that balding will continue. And there are 6, I think, classifications from the 1, the 2, the 3 type up to the 7th, where it classifies how thin the hair are. You've seen some people where the only hairs left is the back
Yeah.
and up to here.
That's it, like your dad.
Yeah,
that's
because
yeah.
those hair
Classic.
follicles are not affected by androgens. And so when they do hair transplant, when we do hair transplants, used to do it quite a bit in my early years, but we transfer the hair follicle from the back. We take punches of it or micro, whatever, and then we get the holes from here, because this is the one that is acted upon by by the testosterone, or the DHT is what it's called. So then therefore this front transfer to the front will grow quite well, but and then because this is nice and thick anyway, they heal up very nicely and close up.
Okay,
Then in women,
so for men, just to summarize a little bit, right?
Okay.
So the pattern that tends, so the primary difference between hair loss between men and women seems to be pattern. Right?
yes,
Yes.
So for men, it would be, my forehead's
You
so
start
high, so it's a
losing
great
here.
illustration. Except
You
here,
start-
right?
Yeah.
And then also here,
More the crown.
more the crown, exactly. Whereas for women, it can be because of
It's-
traction alopecia or all
no,
these other things.
there is a female
Ah, okay,
androgenetic
there you go.
alopecia, where it's also affected by the androgen, by the androgen hormones, testosterone, DHT, and they start in the front actually. There's backward recession of the hairline.
I'm not balding now. My
And-
forehead's just really that high.
Yeah.
But even if I were to bald, I would shave.
Right.
But okay, so for women, it would start here and then
And
Oh,
then
from the
become
front.
then from the front.
from the front,
And
not the
you-
sides.
it's when they bend down like that that I say, oh, okay, you already have female androgenetic alopecia. Let's take a look at how your ovaries are. Did you take any, with menopause, did you do this and do that? Or if you're a young woman, like I had recently a young woman who's bent, and I thought, oh my, that's an early. And so she's
Androgenetic
being examined.
alopecia.
Yeah, we're examining her endocrine status.
So again, backing up, right? Because I think this is a misunderstood topic a lot. So I want to make sure even I understand it. So one of the more common hair losses is something called androgenetic alopecia,
Alopecia.
because it's
Male and female.
related to the androgen hormone, which both males and females have, right?
Right.
For men, it's more common, and you can tell it starts with a more specific pattern.
The recession at the
Right.
V's.
Sort of androgen hormones, by the way, are testosterone and DHT.
DHT is active, the more active testosterone that acts on that hair follicle bulb.
There you go.
Yeah.
And so you can see it's androgenetic because she said these hair follicles around here are not acted on by the androgen hormone. So it's really quite targeted and
Yes.
fascinating if you think about it, right? So androgenetic alopecia can affect both men and women, but because men have more testosterone, they have it more. It's more common among men.
So anything that's androgen related,
Right.
there are treatments for it now. You can either take the oral finasteride or dufasteride, and these are anti-DHT drugs, and then you can have the minoxidil, which increases the vasculature around the follicle, and they are just applied topically. Orally is the finasteride and the dufasteride.
Okay.
I actually make a product in my clinic, which is still done by pharmacies, where we have them together in one product and they apply it in the scalp, and it's fantastic what it does to the skin.
Okay, I want to get into potential treatments and side effects later, but let's
I
continue
see.
first. So we
Okay.
have androgenetic alopecia. What else is a kind of hair loss that tends to occur?
Yeah, some people forget about, quite often they don't think about the senescent alopecia, which is again a miniaturization of the hair follicles, similar to androgenetic alopecia, but caused not by the androgen. It's not hormonal at all. But you'll notice some people who are older already, their hairs become finer as well and diffusely thinner. There's no pattern. It's all over. It slowly becomes thinner and thinner. And this is not, like I said, not hormonal. What it is that it's a combination of things in the exposomes that affects that scalp. Is he a farmer? Or does he go to a farm on weekends, and does he really stay out in the sun, and has this been going on for years? So oxidative processes in the scalp.
All right,
Like-
hold on. Okay, some words to break down quickly. Senescence means aging.
Yes.
Oxidative means basically the process of oxidation, which is also aging. That's how we age, right? So what she's talking about, if I understood correctly, is there's also a hair loss that is unrelated to hormones, but it comes with aging. And it comes with things that age you,
Yeah,
correct?
Environmental exposure.
Environmental
Environmental
exposure. So the other big word she used, so we had senescence here, we had oxidative, and we had exposomes, which is different from genetics. So genes are the things you're born with, But the exposomes are the things that aren't in your genes, but that you do, either you eat or you practice or you're exposed to, that affect your body and your skin.
Does
Let me-
this,
yes,
sorry,
go
does
ahead.
this mean that for senescent alopecia, all of the typical things you do to stay in good shape as you age, like eating well, sleeping well, exercising, etc., 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 would help with this?
Absolutely.
Okay,
Absolutely,
good to know.
because it's an oxidative process.
Right.
And may I mind you all, I keep talking about this, in COVID time, remember all those chemicals that are in the air nowadays, from the Clorox and, am I naming, no, it isn't a trade.
Just bleach.
It is.
Anyway, chlorine-based chemicals that are in the air.
Any brand, as long as there's chlorine,
Yes.
bleach, that kind of thing, okay?
Yes.
So we're clear.
So those produce an effect on oxidation, and the thing about it is that it's rather low compared to being directly under the sun. But these are the things that slowly over time accumulates and actually will develop faster aging of your scalp hair as well as of your face. You know, so if you do not protect your skin right now with a protecting moisturizer and a sunscreen for visible light and indoor lights, you know,
You're asking for trouble.
You're asking for trouble, yeah. Protect your skin even though you're indoors. It's not just for going out in the sun.
Right. So again, we have androgenetic alopecia. We have senescent alopecia. Is there another type of hair loss?
Yeah, also common nowadays, I see them quite often, is telogen effluvium. And
love
the
that
nice thing about telogen effluvium is that it's reversible unless you make it chronic. Give you an example.
So just to explain, telogen effluvium is when your body goes through a bit of a shock. Something major has
Yes,
happened.
that's right.
For women, it would be pregnancy and giving birth,
Yes.
for example. For some people, it's a mega infection, very high fever, maybe even chemotherapy,
Therapy.
right? Is a classic thing. And basically your hair follicles go, nope, I'm done. No, we're going to stop for a second.
Yes.
And then when things relax again, then they're like, okay, we're in the clear. Whew, we can start producing again.
Is that a body response related to conserving energy and directing it to
Most
where
likely,
the
Ron.
stress is?
Most likely. It's a very good point. But the point is that most of the hairs in your scalp, about 80 to 90%, are in the growth phase, and that can last as long as 2 to 6 years in some people. The hair just keeps on producing hair, and that's why you have to go to the parlor and have it cut every so many weeks or month. Now that's called the anagen, and it's only about 85% of the scalp hair. The rest of it is called cathogen, but the important one is the telogen, which is just like we people need to rest now and then. The hair follicle after that growth phase has to rest,
So
and
it's-
that's
there's
called
a
the
cycle.
telogen. Yeah, this is part of the cycle of life for the hair. The telogen phase lasts normally 2 to 3 months. So the hair bulb does nothing anymore about producing a hair shaft. Instead, it just closes in like a baby. It has to go to sleep, right?
Takes a rest.
Yeah, takes 2 to 3 months, and then it wakes up again. In the meantime, that hair that no longer is connected to the bulb, to the hair root, it just sits there, or if you brush and brush, it will all come out also. But the number is only about 10 to 12% of the telogen anyway. So you don't notice you just see it when you go to, every now. But what happens in this acute stress, whether it's mental, psychological, or a fever, a high fever, or a severe infection, or your parents got, COVID, which I know some doctors did, that can be so stressful that maybe even 50-60% of the hair roots stop. Like Wampi says, they go into protecting themselves, and then 2 to 3 months later, which is when the bulbs recover, they will then start to grow. But because there are so many anagen hairs that are pushing off the old hairs, all of a sudden you see
It
so
looks
many
like
hairs.
it's getting worse,
Yes.
when in fact the hairs are starting to
It's-
grow again.
yes.
But that is telogen effluvium. That's actually rarer, I think, among men.
They
then
do get it too.
they do get it, but it's not. I would argue the androgenetic one
Yes.
is probably, and the senescent one.
Yes.
Is there another kind, or that's pretty much the main ones?
Those are pretty much alopecia areata, the round spots. Common also with stress.
There you go.
Yeah, in children it's common,
So
as well as
folks.
adults, any age. Alopecia
So can we
comes in.
please double down what Wampi was saying?
Relax, yeah.
You know,
What
all the
is
stuff
it?
you're supposed to do for your health, right? Eating well,
well, sleep
exercising,
well,
sleeping, exactly, exercising,
Meditate.
meditating. This is good for your skin, your heart, your body, everything, and certainly hair loss, right? Because a lot of it is related to stress.
And talk about your problem. You know, I find that most people who come with really stress situation or telogen don't have anybody here in Manila because they're staying for some company or whatever. So they're alone, So I
Or
find,
even, a lot of our friends in the States who are cooped up and maybe are in a state that's separated from friends and family. There's a lot of options now online for free therapy. Take advantage of it. Okay, so we have a question from Revi. How effective is low-level laser therapy for hair loss?
That's always been a good question, including with infrared, and at one time I wanted to make a study on it, but decided it wasn't really my field at that time yet. Anymore that at one time I wanted to use coconut water because of the growth hormones it contains. Somehow that, petered away, is that the right word?
Yeah, but it's not like we're at a loss for stuff to study. She has a pile this big, so she'll get to it at some point.
Wanted. Including, as I was reading for this hair growth thing, the hair loss rather in men, this was very interesting. I somehow decided, let me see what other people are talking about. And this particular article is so good, it went into thorough, examination of the current knowledge on the molecules, the genes in hair loss. But at the end, it was very interesting. It talked about the phytochemicals. These are the plant chemicals that can actually also have some function or action on that prevention of the formation of the DHT from testosterone, so that it prevents hair loss. Plus, plant derivatives are basically very good antioxidants. That's why we eat vegetables and fruits that's fresh, right? So,
Okay,
interesting.
but in terms of low, I lost it. Low level laser therapy.
Oh,
for
back to
hair
that
loss.
question. Yes.
So I think this is a great question, Revi, and thank you for asking, because I think it will nicely segue into, can anything be done about hair loss? Now that we know what it is, and by the way, thank you, Joseph de Guzman, for calling me a medical lexicographer. I didn't know that was a thing, and I will continue to aim to be that.
Hi, Joseph. My favorite guy in
That
psoriasis.
guy's leader in psoriasis. Oh my gosh, please reach out to Sorphil if you have psoriasis. But anyway, so back to low-level laser therapy for hair loss, and then we can talk more about, is there anything that really can be done for hair loss? So low-level laser therapy, what are your thoughts on that?
Balance. The body is so balanced. Pro-oxidants, antioxidants. That's what we have everywhere. And they have to be balanced. The pro-oxidants will begin the process of oxidation, which gives us our energy, and all the things that we need to do, from exercise to
How's that
meditation to
related to
whatever.
low-level laser?
Wait.
She's
Thank you.
getting there.
This is my daughter. I'm getting there. I have to
Okay,
lay
okay.
the groundwork.
Sorry, patience.
Okay, so balance.
Okay.
We also talk about the fact that oxidation is a very important process, both to start and both to end. Because otherwise it goes haywire, and this is why we get inflammatory diseases. Now, going to laser then, what does low-level laser do? It induces some kind of an inflammation, because it is like sunlight or electromagnetic radiation of whatever laser it is, whether it's in the low level or the short or the long, like NDYAG, or So it depends upon your doctor who's doing it. How low is low? Is it just enough to excite oxidation that is good? Or will it be instead an oxidation that's a little bit too much, so that it actually destroys tissue? So one makes things grow, and the other one.
So assuming that it's done, is that what you're going to ask?
No, I was going to say, from what I'm hearing, is it's a therapy that depends very much on the expertise of the doctor.
And the
Because
machine.
if you do it properly, it's okay, it's good. If you do it a little bit over
Yes.
It's
the
actually-
level, it's harmful.
It backfires.
Considering your background, are you photo damaged in the scalp to start with already? You know, has there been lots of chemicals that have been applied that could have been an irritant or whatever? It's already in oxidation, for instance. You know, you're going to add another oxidative procedure might be too much, so that instead your hairs, you know,
Stop.
stop.
So, sorry, again, to be clear, low-level laser therapy, if done well and really perfectly aligned with your needs and, let's say, the energy versus your skin damage, etc., has shown success in hair regrowth?
There have been some. I remember some people who came into town and demonstrate that I don't have the experience. So maybe somebody else will, and is probably very happy because they have the experience and they know exactly for what type they should do and at what level.
It doesn't seem to be a particularly consistently high rate of success, though.
I don't know.
Yeah, so maybe more studies are needed,
Some
which
people
isn't
become very successful
Yeah.
if they really study it.
exactly.
And,
So that's not to say it doesn't work.
Yeah.
That's saying it's probably early days, but theoretically it looks like it should work if the stars align
That's
and
right.
everything is done perfectly and the person's
Correct.
very well skilled in that. Okay, we have another question here. We used a very, very gentle hair and body cleanser, shampoo, but my hubby's hair loss really worries me because of genes. What would be the best way that would be less invasive? I'm assuming you mean versus hair transplant. What's another way to prevent hair loss?
To prevent hair loss as well as to treat it when it's already there, the current treatment is really still the minoxidil, then the finasteride, dufasteride taken internally.
Okay.
Those because they're really directly direct their attention on the DHT.
And that's applied
Inhibition.
on the scalp?
Minoxidil is, I have a compound that I use in my clinic that the pharmacist does for me, which is also using finasteride in it. And I should do a study on it because I add olive oil. Olive oil is an amazing oil. You know, you all know about the Mediterranean diet, and it's really very good in the diet, that whole thing. But in addition, on the skin, it has an interesting property. It allows barrier penetration of actives that you have on them. So if I place a little bit of olive oil there, first, together in the compounding is usually what I do. And then put on those active ingredients, as long as the molecules of those active ingredients are small enough, less than 500 Daltons is what we call it. There.
Okay, so let me clarify a few things in that wonderful, rich chunk of information. Number one, you guys hear us talk about coconut oil all the time, and it is wonderful. It's barrier repair, hydrating, it even has growth factors, fantastic. Olive oil, other oils, we have a nice live stream on oils that talk about other oils. There are many good oils out there, olive oil being one of them. Coconut oil is still the top, for her, for eating, for cooking, and for skin and hair. But olive oil is a pretty close second for eating in particular, but also for a very specific function. Olive oil is actually not great for barrier of the skin.
No.
So if you have barrier defect,
opposite.
exactly, it's the opposite. It kind of disrupts it a little bit, but for a very particular need, that's good because it can that dysfunction can help actives penetrate deeper into the skin. So for treatments like for hair loss, where it's you kind of would benefit from how do I get those actives deeper in the skin to work better, it's a good idea. So what you can try potentially, but check with your doctor first, is apply the olive oil first and then your active. And she has a compound where she kind of does that already in one. But the two that she mentioned there were minoxidil. I think that's actually a trade name. I don't know if it's become a generic. So the active.
I'm sorry, I can't remember the generic.
And then the other generic was
Finasteride or dufasteride.
finasteride or
Dufasteride.
dufasteride. So ask your doctor about that if it's right for you.
You can drink that.
There you go. I do want to ask about side effects for these treatments, because I heard a friend of mine was asking, I'm happy with my treatment for hair loss, but I've heard there's a side effect of loss of libido.
Yes, we always tell patients when we give it to them, the oral medication. There's actually a study, or a couple of studies on it. Interestingly, what it says, bottom line, is that there's about 3 to 4% of people who complain that they of some loss of libido, but none of them went out of the study.
Okay, so what have we learned from this study?
The hair was more important.
We've learned that in this particular case, the man chose their hair over sex. So apparently hair
or
is
found
more
other
important.
ways, excuse me.
Yeah. Yeah, I mean, I this is another potential live stream maybe where we talk about sexual attitudes through eras. But there are obviously wild extremes of very Puritan sort of, it's absolutely bad and evil, and then the other extreme that if you don't have sex every few hours, then there's something wrong with you, right?
That really
Somewhere in the middle is a good thing. It's healthy, it's normal, it's natural. But also sex doesn't have to define you. Sexual activity doesn't have to mean you're more macho, right? It doesn't define you. So if at this point in your life you decide, actually I want my hair, I want my hair, then it doesn't make you less of anything, right? But like anything, or like so many things in life, you have to choose.
Yeah, I
You
feel
might
that
have
now.
to choose for now. Okay, we have another question. Is coconut oil effective for hair loss, especially when related to hormones? This is from Diana Balawang.
Not so
on
much for
YouTube.
hormones. It doesn't have hormones until I do my study on the water, the coconut water, because it really has lots of hormones, kinetin and all of that. But coconut oil itself can be good if the hair loss is due to oxidation. Like I told you before,
So not
senescent.
hormones.
Yeah, not hormone.
Yeah, okay.
The senescent, remember I told you about the fact that
Yes.
the
Exposomes.
environment we have, and the traffic and the pollution from the atmosphere, whatever factories are near enough that can affect you, or the volcano erupting and producing this sulfur that goes. There are lots of things that you have to consider as being exposomal or environmental that can affect, that can produce slow but continuous oxidation over time, and therefore for that the coconut oil would be good. I've
Okay.
always wondered why the grandmothers are always talked about in
Back in the
folklore.
day, yeah.
In folklore, that they had this coconut oil that they applied, and you can see black, gorgeous, thick hair.
Gorgeous hair for
Maybe
a
there's
long
some truth
time.
to that.
So
yeah.
it needs more study. But
Yes.
Okay, so I'm going to rifle through a few questions because we have about 12 minutes left. A question on YouTube: is it normal for middle-aged women to experience hair loss?
Yes. No. Well,
It's not uncommon.
It's
How
not
about that?
uncommon. That's
Yeah.
a better word. It's not uncommon, but it is abnormal in the sense that it's produced by an upsetting of the testosterone balance with the hair follicle.
Or it could be because of telogen effluvium.
It could also be,
like we were
especially
talking about.
now. I'm seeing a lot of telogen effluvium because of the stress.
Yeah. What we didn't talk about, and I think it applies to both men and women. Women tend, like our daughter, wears her hair back a lot for ballet. But some men who
yeah.
have long hair, who wear their hair in ponytails, there's something called traction alopecia,
Yeah.
which is, it's just all the, if your hair is pulled back all the time, you basically stress out the roots, right? Okay, another question. This is from Gian. I wonder
This
if
is
you're the Gian I
another
know.
man-
Oh, right.
male
This
in
is
the
our other
family.
guest today.
Yes.
So Gian is asking how to avoid ingrown hair after shaving and best practices during shaving.
That's really
Juanpi
tough.
can answer some of
Yeah,
it. But
that's,
ingrown hair, I think people don't realize what it is. Can you explain what an ingrown hair
Yeah, an
is?
ingrown hair is basically if you cut it too close, so then that hair stalk is what you call it. It recedes.
It
And
gets
then-
shy,
right.
or it retracts.
That's right.
There.
And then when it grows again, it's supposed to go back along the same, the
Route, the same canal.
shaft canal.
Yeah.
But because it's curly anyway, so it goes like that, and then it
You
forgot
can't
where.
see her hand. Yeah, there. Okay.
They forget the hair.
They lose their way a little
There
bit
you
to
go.
go out the pore. So then those bumps are created.
There you go.
And how do you deal with ingrown hair then?
Cut less closely to the.
It's
yeah.
difficult, huh?
Yeah,
Because
let's
it's stuck
listen to
under it.
Wambi.
Yeah.
What can you say about what have you done?
it's not
Because
a-
he's got curly hair.
Yeah, but it's actually not a big problem for me shaving. But from what I've seen and happens is, yes, you don't try to shave so
Close.
close.
Yeah.
Also, the other thing is make sure that you use a good aftershave to prevent any
Yes.
infections.
Right.
Yeah, that's true.
Um,
Because when it gets stuck there,
Yes.
inflammation can happen.
Correct.
And
Yeah.
then infection, and that's sort of the real discomfort. No, so I think what's interesting is so many shaving ads or information targeted to men who shave, who get ingrown hairs, but some women could actually also. They really emphasize close shave.
yes.
The closer the shave, the better. That's not always true, especially African American hair, very tightly coiled, does not benefit from too close of a shave and might benefit from an electric shaver over a very tight shave like that. And, or, again, use a very good aftershave treatment of some sort to lessen inflammation.
Let me give you another tip. If you use the coconut oil as your antiseptic against COVID, you only apply it twice a day, as long as you don't place alcohol on top of it later. But you apply it into the nose and breathe into the skin of the face, including that bearded, shaved area, and go in other places of the skin where you are exposed to other people. That will protect you from COVID and other microorganisms getting into you, including it's anti-inflammatory. We've proven this in a number of studies already, how anti-inflammatory it is. So it can be against the inflammation as well as against any bacteria that may want to inflame you. So that's a good trick for you to do, is use it as an antiseptic and also to prevent, what do you call it, ingrown hairs.
Another thing to add
On the shaving, yeah.
on the shaving side is if you use a sharp blade, you need to go only once or twice on the same area. If you use a blunt blade or blunter, you might need to pass 2 or 3 times, and that might irritate the
That's
skin.
very true.
There you are.
Because you're constantly scraping it.
I'm
Exactly.
so glad we have a man here to explain it.
That has to shave regularly.
We have a regular shaver here with us. Other things that are great tips for shaving. People forget what really is your friend in shaving. 2 things are heat and moisture.
Yes.
Which is why in barber shops you have that hot towel first. It keeps the moisture in, it keeps everything very soft throughout that shaving, so that you actually need to pass the razor less, right? So that's always good. And another thing, just for the environment, you found non-plastic.
Yes,
right?
well, there's
The
many
old style.
old school, and it's much cheaper also.
And it's not disposable plastic, which gets in our
Yeah.
ocean. So
So what
it's
is
nice.
it made of? Metal.
Metal.
Yes. Well, be careful if you have a nickel allergy.
Yes.
You have to check.
Unless those are made of stainless steel.
Yeah. If it's very
Or-
high quality.
Because you don't tend to reuse and reuse it, right? Except for a short
No,
while.
the blade is stainless steel, but
Yeah.
the razor
Ah,
itself, the
yes.
the one that I have is made of Zamak,
What's
which is
that?
a compound, a
It's a
metal compound.
It
that
might
is
have nickel in it.
possible.
But you never know.
It
You could
has
maybe
zinc.
get a wood something.
Yeah,
There's a great website called lifewithoutplastic.com that might have options.
There's plenty of options.
Yeah. Okay.
Wonderful.
So Anonymous
I'm
is
learning a lot.
asking, is white hair preventable? Okay.
The reason for that white hair early in my life is because
Early
I'm-
in my life.
well, about 50.
You gotta love it. Okay. Early in my life. At 18.
It just happened so early.
It was 2 weeks ago.
It's because I'm allergic to dye. Now, regarding to prevent it, and so therefore you have to use a hair dye. So to prevent whitening, that's kind of tough. I don't think there are any molecular studies yet. There's got to be. I'll look it up again. I'm really sorry I didn't look that up. If there are pills you can drink or
Ooh.
things you can apply.
What I have noticed for me is if I'm going through, let's say, a particularly stressful period for whatever
Yeah.
reason, I tend to show higher level of white hair, and but then it comes back a little bit.
So if you'd be interested, actually, one of our topics that we're going to be doing soon is hypoallergenic versus natural versus organic. And that
yes.
came up from one of our live streams. So if any of you are interested in learning more about hair color and whitening hair
I'd love to.
and treatments, let us know in the comments, because if that's an interest, then we can make that happen.
Fantastic.
Okay, another question from Ana Del Rosario. Thank you first to Angela. I'm so happy that you enjoyed today and you have to choose. And Matanglao 03, I'm psyched that you like the tip about the traction alopecia. I tell my daughter, right, after
yeah,
ballet,
ballet.
wear your hair down as much as you can. Don't wear it up. Okay, Ana Del Rosario on YouTube is asking percentage of the cause of hair loss, which is more common due to hereditary or due to lifestyle.
Percentage.
The androgenetic, I think, is the most common.
Right. Percentage of people who develop alopecia in general, or percentage of those with the positive
I think
family
she's
history?
asking which is the most common, the hereditary or the senescent, I guess.
Oh, the hereditary seems to be.
More common.
Because particularly in the Philippines, at least so far, we Filipinos don't like to go out in the sun so much. I mean, you know, there's
Yeah.
few people who really bake out in it, but they do exist here. Otherwise, yeah, I don't have the percentages, is what I can say, but it does happen. Be careful, be aware of that, because our environment is changing. You know, I wrote a chapter in a book that just came out in June, and my chapter was called "Aging Skin: The Influence of Exposomes or Diet and Environment." There you go. Let us know, and because it was in webinars, I talked about it, and we can share it with you.
Yeah, we
It's
can
already
dig,
published.
there you go.
Yeah.
We can dig deeper. We can
About
share that link.
diet and
actually in the
environment.
comments.
It's very interesting.
Okay, I'm gonna rifle through because we have 4 minutes and I still have to do close up and stuff. Arlene Arencio on YouTube, how effective are organic shampoo bars made from VCO and sometimes aloe vera and Google for hair loss? There seems to be a lot being sold online.
Coming.
You know, again, studies. There aren't studies. So coconut oil for the hair, coconut water for the hair, she was mentioning, theoretically should help. But as of right now, there are no clinical studies that show decisively that organic shampoos like that, also organicity may not have a lot to do with it. No, you really have to look at the active ingredient for it. As of right now, there are no clinical studies, you know, randomized, double-blind, published in peer-reviewed journals that show that they work. Okay, is hair loss connected to scalp health? Yes.
Yeah. We talked about senescent as an example.
Exactly.
Senescent alopecia.
If you stress the roots of your hair, so traction alopecia is one example of the roots themselves really physically being pulled, right? The other is she's talked about inflammation of the scalp. And yeah, anything that irritates it, weakens the roots, absolutely would be part of the exposomes.
There's a
And that-
condition
that's
called
innocent.
cicatricial alopecia. It's not as common. I'm sure people who are really into the hair as their specialty will probably tell me there are more than we think. I've seen a number, but it's more common in people with dark skin. You know, in the States in particular, they seem to be reporting it a lot. It's called frontal fibrosing alopecia. These are the cicatricial, scar-like. And what people are saying is that it's really basically,
Yeah.
it basically is an oxidative process also, probably with some low-grade infection that destroys that bulb area where the cells are.
So care for your scalp,
Yeah.
folks.
So, just a warning, our world has now become so environmentally bad for us, both from the food we eat as well as the things we're exposed to. Like I said, because of the traffic, because of the soot, because of the ozone and low-level ozone that we're getting, you know, and other things that contribute to the environment, especially EDSA when it comes back again, and with the traffic that normally is there.
Highways,
Highways, right?
where there's more traffic.
Yeah. So,
Okay. So
And-
yes, look
yeah.
out for exposomes, anything that you're eating, lack of sleep, stress, bad food. All the stuff you're supposed to be doing anyway for your health will help you keep your scalp, your roots, your luscious locks healthy. One last question from Joe. I'm suffering hair loss. I think it's hereditary. Any suggestions? Minoxidil did not work for me. as well as the other hair growth products.
So there are basically two concentrations. There's 2% and 5%. Try the 5%. I use 6% in my clinic. The compounding I was talking about, and actually mix all those minoxidil, finasteride together with the olive oil. So,
And then there's
but
hair.
ask your doctor because he may,
Or
just
she.
like I'm offering, he or she, sorry, may have something to offer that's a little stronger. And regarding that dufasteride, the oral finasteride,
So
Yeah.
again, something that merits repeating in every live stream that we do, don't self-medicate.
yes.
If you're somehow getting
It's your
access to
hair.
these drugs, then you need to not. You need to go through your doctor to rule out any other reasons for the hair loss. Maybe those actives aren't working because you need a higher concentration, which a doctor should be able to tell you, but maybe they're not working because there are other things to consider. Maybe there's a raging, and I don't know, there are other things to consider. Just make sure you see your doctor. Don't self-medicate with this either.
It's now shown that it's more common associated with evidence of internal inflammation, like people who are balding are more prone to the development of cardiovascular disease, hypertension, diabetes,
There you go.
insulin-resistant states like obesity.
Right.
You know.
And
So
yeah.
be sure you
And because of
consult.
telogen effluvium we discussed earlier, and Juanpi pointed out, there might actually be a relationship between other inflammations in the body and what's happening with your hair. Lester made Bahabul question, which is a Chase question, is a hot shower bad for your hair?
If it's with a lot of power in it, like
A lot of water pressure, yeah, probably.
yeah.
Again, so things to remember, and I'll summarize when you have to go. You have a 10 o'clock.
Yes, I
Okay,
have
love
that.
you. Bye. Thank you. Mwah. Okay, go.
Juanpi, thank you so much. I learned from you.
You want to move here?
Doctora.
Yes.
Sure.
Okay, so I will summarize. Thank you. Sorry, she really has to run. She's a thing. So, to summarize, right, with regards to hair loss, a lot of it is really genetic and hereditary. But as we talked about in psoriasis and in eczema, just because something is hereditary doesn't mean you're going to get it.
Yep.
One thing is your genes. The other is stuff that you do in your life and the things you're exposed to and your habits and practices and stuff that affect the proteins that turn on and off certain genes. So you can have diabetes in the family, and if you really eat so well and you exercise every day, you may never get it. You can have psoriasis or eczema in the family and never get it because you avoid allergens, you're very gentle with your skin, etc., etc. So same with hair loss. There's definitely a genetic factor, a hormonal factor. We talked about androgenetic alopecia, which is from the androgen hormones. Androgens are testosterone and DHT, I think is what she said. And so men, it tends to be more common among men because they have more testosterone. So that's androgenetic alopecia. There's senescent alopecia, which is basically as you age, the things you're exposed to. There's also traction alopecia, that pulling from having your hair up in a bun, or that wasn't smart.
No.
Or in a ponytail, and certainly things like hot water and very, very strong water pressure. And then things like a lot of allergens that can again irritate the scalp, the roots. We just had another question that came in. Akashira, hello again. It's good to see you back. Hair dye could, if the hair dye is an allergen, exactly, and if it affects the roots of the hair,
Inflammation.
it can cause inflammation and cause the hair fall, or cause telogen effluvium, which is another thing we discussed, where the hair, because of extreme stress that the body or skin is experiencing from giving birth, chemotherapy, etc., the hair goes, we're going to rest a bit, we're not going to produce. So all these things can definitely affect hair loss. So a lot of the things we recommend, for sure, take care of yourselves. So this is an anti-inflammatory diet. Again, we recommend, as a shortcut, the Mediterranean diet. But skip, maybe have more coconut oil than olive oil. And then sleep 7 to 8 hours a night. Stress will really affect your hair.
Exercise. I mean,
Exercise
the usual.
daily, all that stuff. If you need more active treatments, there are many options. So minoxidil was one.
Fino something.
Mom mentioned several, but for some of them, the trade-off is libido. But again, your sex life doesn't define who you are. And if right now your hair loss prevention is a priority, that's what your priority is, right? Other things that can help, Juanpi was going to show. So for hair, we recommend, I'm going to ask you to hold this up because
Okay,
it's
I
just
will hold
easier.
this up.
You can be Gavin today. So you
Okay.
hold it up, you make sure
There
it can
you
be
go.
seen. There you go. So Essence Superwash or Clark Wash or conditioner, because they're very gentle on the hair shaft and certainly on the scalp. For cleansing, Juanpi and I both use this.
Yes, we use the same one.
The 1635 cleanser. Again, male and female skin, there's not a lot of difference. Skin under a microscope is skin, right? Skin cells are skin cells. So,
I have to confess, cleanser, I use whatever is in the bathroom.
all right, well, what's in the bathroom is usually one of ours
Yeah,
anyway.
yeah, it's always a VMV one.
Right.
It's just sometimes super skin, sometimes whatever
right,
it is
so
there.
this is a super skin cleanser also. Basically, under a microscope, skin cells are skin. You hold
where?
your hand behind it so
Oh,
that it helps.
There.
So skin cells are skin cells. So you don't, and we and VMV have never done sort of for men, for women. You look for what your concern is. So dry skin, get our dry skin stuff. Oily skin, get our oily skin stuff. Rosacea, eczema, etc., etc. Just choose based on the concern, not how it's packaged and what the language is. So that's kind of the main thing. Very quickly, oh my gosh, we have to pick winners. Okay, so sorry, we're running late. Okay, so winners on YouTube, we have Matanglawin 03, Angela Manalo, and Diana Balawang. Oh my gosh, are they all women? I feel bad. Oh my gosh. We have the pre-shave oil, which I don't have in front of me, unfortunately, I'm sorry.
I didn't
And the shaving cream, 3. This
Yeah.
is great. It's for all beard types.
Yeah.
So there. Congratulations, you guys, and I hope this was helpful. Definitely check us out next week. I think we're going to be talking about skin myths, like common skin myths. That's going to
The
be exciting.
scary ones.
Yeah, no, stuff that's like BS. Anyway, we'll demythify is what we'll do. And then follow us on Instagram and YouTube and Facebook, and shop vmvhypoallergenics.com. We're offering a nice special on our virgin coconut oil in this size, which
Yeah.
is super handy. The frontliners love it because they can keep it in their pockets and disinfect frequently. In the Philippines, we're offering this. I get my dew pouch with 4 products in it: the Essence Clark Wash Conditioner, Red Better Cleanser, and Oils Well Mini. And Oils Well is awesome because it's virgin coconut oil plus monolaurin. So that's primarily it. I don't want to keep you guys a lot longer. We're already over. Thank you so much for
Thank
watching.
you very much.
Have a wonderful, what is today? Midweek.
Midweek, yes.
And stay safe, everyone. Calm breaths, health. And don't forget, please, to comment, because we do answer. We take it so seriously. And I definitely answer. I look at all of our customer questions, and most of them go through me. I'm part of the customer support team. So please ask whatever questions you have, and let us know what other topics you'd like covered. Thank you so much, and thank you, Juanpi, for
Thank you.
joining us. Okay, bye.